listen to families, children and young people in our communities. Our new Healthy Together service builds on the strengths of these relationships. It's important to us that we continue to engage with local people. They help us develop innovative ways of working and flexible services that meet their needs.
I always thought flu affected the elderly and everything else, but actually, you know, experiencing it firsthand for somebody that was completely sort of healthy, sort of out of the blue, if I can sort of urge anybody to have themselves or their young ones or their children vaccinated, I think that's the most important thing that I could ask for anybody to do.
Nurses are the people that patients trust more than anyone else really, and they tend to be the people that the patients talk to. So when a person's going through a difficult time, it's the nurse that reaches out their hand, and that's the hand that the patient holds. I'm really pleased to say that we've got a fantastic bunch of nurses working in the hospital and in the community.
The majority would be in hospital, so we're preventing hospital admissions, but also some of them we're helping to get them out of hospital maybe a few days earlier than they would have done normally, because we can provide the support that was traditionally provided in hospital, we can provide in their own home.
So we get loads of positive feedback from patients and relatives and also staff on the ward. They see the impact of what the Meaningful Activity Coordinators do.
We have designated September as a month where we focus on the care that we give patients during their end of life and the bereavement support that we give to carers afterwards. To this end, we are holding a number of cafe conversations with our frontline staff across the whole of LLR. We've just had a very successful one here at Loughborough, attended by very well motivated and caring clinicians and professionals.
We felt that there was a gap in resourcing and finding information for age-specific services for people living with an onset of dementia. You find that there's plenty of services out there for people over the age of 65 with dementia, but actually people themselves living with their diagnosis ask specifically for a more age-appropriate support service, as they feel that their issues are different from those experienced by people of an older age.
British Partnership NHS Trust is donating some of its old beds to parts of the world where they will get a new lease of life.
Hello, my name's Dan Norbury. I'm an HR manager for Leicestershire Partnership Trust. I'm at our recruitment fair today. In the first hour and a half we've had 260 people come through the door, so it's really busy. Everybody's talking to our staff.
A yellow book is designed for people with mental health issues. Its aim is to improve their well-being and their mood through self-help advice and inspiring photography, artworks and poetry.
From